Here we are. It's the day before my surgery with Medici Capelli in the morning. I've read through my document. I've got my hats here. Not sure which one I need to wear, but I've got to wear a hat after the surgery. Apparently I don't need to have any bandages. It's been an interesting week because as part of the preparation is no coffee, no alcohol, no stimulants, which is probably a good thing. Go in feeling nice and healthy, which is good. I'm a little nervous, obviously, you may be able to tell, but look, I know they're good people and I'm sure they'll take really good care of me, and I'll report back to you in a couple of days after surgery and let you know how it all went, and I look forward to having some more luscious hair.
So, as we discussed, what we're going to plan on doing is putting some fine hairs, some single hairs, through the front here to thicken this up, and especially this frontal forelock area here, because this is really important. I've got quite far advanced male pattern baldness. I'm in hair transplant myself. We've lost here, but I've got a good forelock. It's very important. It makes a big difference. So what we want to do, put some all along the hairline, not bring that down any lower. Your hairline's actually, if anything, a little bit too low, just in the corners here. So we just want to thicken that up a little bit, but particularly that middle third, and give you a really good, slightly denser look there in the middle, and it will make a big overall difference to the look of people. We're going to put some in the crown here, thicken this up, but when people look at your face, this is what they look at. So this is the most important bit. We want to frame the face and especially just get that forelock just right for you. That's what we're aiming to do. So we're not going to do a lot of hairs today, but I think it might make a really good difference.
Okay, great.
So the main things to remember, and you probably know this, twofold. First of all, the hairs that we put in are little tiny stubbles, so they're only a couple of millimetres long. Quite often after a couple of weeks or so, they'll actually shed and fall out. But don't worry, because the root will still be there and it will grow a hair. Because each hair is growing in its own cycle, some of the hairs that we put in are going to be actively growing, some of them are going to be in a resting phase. So it's going to take 3 months for some of the hair to come through, but it's going to look better and thicker and longer, 9 months, 12 months, even over a year it will still continue to grow and look better. So you've got to be very, very patient.
I realise.
Alrighty, come on through then. You comfortable there? You can talk to us anytime you want. Sometimes we don't answer straight away, we're not being rude, we're just sometimes counting. Either counting the little slots to put the hairs in, or we're counting the little hairs that we're cutting.
So Trevor, scale of 1 to 10, how bad was the anaesthetic?
Probably a 2 out of 10.
So not too bad?
No, it was fine. Just a little stimulus, Christo. But yeah, it was really easy.
It's stressful coming in, but I feel really relaxed and really pleased with how everything's gone. Thanks, guys.
Everything went extremely well today. Textbook procedure. Just cleaning up at the back here, and we're done for the day.
Okay, Trevor, procedure went absolutely perfectly. Couldn't have asked for a better patient. You obviously did all your pre-ops to the T, no coffee, no alcohol, all that sort of thing. So very little bleeding. Your donor area, the sutures came together perfectly. We got over 723 grafts, I think it was. And of those, a lot of them were doubles and triples because they were in the crown. And a whole heap of singles through the front. So out of that approximate just over 700 grafts, roughly, because a lot of them are double and triple hairs, you're looking somewhere around the 2,000 to 2,500 hairs.
Wow.
So you're going to get really good coverage and really good density through the front there.
Correct.
It's also going to, because you've had previous work before, it's also going to disguise older procedures. Everything's a lot more refined now, so the single follicles that come through the front are going to give you a perfectly natural hairline, but it will be undetectable.
Yeah, thanks, Mark. That's great.
Okay, so what I'm going to do here, this is your post-operative procedure bag. You feeling okay after the procedure?
Yeah, I feel a bit groggy, a little tight, but yeah, I'm just astounded. I mean, the procedures I've had in the past, I was so out of it, all bandaged up, but I actually feel like I can't explain how.
That's great.
Yeah, it's a really good outcome.
That's what we like to hear. We like to hear healthy and happy patients afterwards. Now, first things first, your post-operative stuff. Everything we've got printed out here, I need you to follow to the letter. And that's why you also take it home, so you can refer to it.
Yeah.
Okay. It's very important that you follow these steps, the do's and don'ts. Basically, you've spent the money, it's your hair, we've done our job, you need to look after it now.
Yeah.
For the next 48 hours is crucial.
Yeah.
The next 10 days is important. After that, it's your own hair, it grows for the rest of your life, you treat it as normal.
Yeah.
But just for the next 48 hours, it's really important that you follow this.
Okay, so here we are. It's Sunday. My operation was on Friday. I've got a little bit of swelling on my forehead, but I've got to say I'm extremely impressed. My little grafts that they've all done up through here and here is all scabbing. My donor site is here. No swelling at all, next to no pain. I've had some painkillers, but I've literally been just chilling on the couch, doing a little bit of work on my computer, actually playing with my puppy dog who's right here. But I've got to say, the recovery, day 2 in, no issues, fantastic result. I'm really pleased, and minimal swelling. Thanks guys, you've done a fantastic job. This experience compared to the treatments I've had in the past is just totally different, and like I said, second night the donor site was just slightly tender, but like nothing, went to sleep, it was fine.
Yeah.
Had a couple of Panadol or whatever I had, and I haven't missed a beat. Seriously, I had a bit of a rest on the Saturday, took it easy the week after, but I still worked. Back at Monday, I could have gone to the office if I wanted to.